Please just stick around and hear what stroke is all about. As I earlier said, I'm not ID. So let's talk about stroke. This diagram you're seeing is the diagram of the brain. This part indicates stroke. What happens is that when there is decreased blood supply applied to the brain, that area that is deprived of oxygen will die. As you can see from this diagram, we have two major types of stroke known as the hemorrhagic and the ischemic. I won't go deeply. When we reach types of stroke, I'll explain further. But what this diagram illustrates is that at this point is where stroke occurred. This is the entire brain. Then the stroke occurred at this point. Then for the hemorrhagic, means that there is bleeding. The blood vessel in the brain ruptures, releasing this blood here that will go to the brain tissue. While the ischemic is just that there is decreased blood supply, that area will just die without a bleeding. So the difference between hemorrhagic and ischemic is that hemorrhagic bleeding occurs, while ischemic there is no bleeding, just part of the brain that is dead. So when we say stroke, what do we mean by stroke? It is the third leading cause of death worldwide. So that is why it's very important for you to take good care of yourself. Research reveals that its mortality is higher in the blacks, especially the biracials. What do we mean by biracials? Someone that has two races, for instance, the maybe African American and so on. Also, stroke is more common in the developing countries and in males than in female. It is a medical condition where the blood supply to a part of the brain is disrupted, leading to the death of brain cells. It can happen in two ways, as I earlier said, which is either the brain lacks blood supply or there is rupture of blood vessel leading to bleeding, which I mentioned earlier, hemorrhagic. So research in 2020 stipulated that 1 in 6 deaths from cardiovascular diseases, that's the heart diseases, was due to stroke, and that every 3.5 minutes someone dies of stroke in the US. The disease mostly affects people of age 65 and older, though it happens in younger people of 45 is not that common. I remember some months back I lost a 41-year-old male patient owing to stroke. So even if you are 35, 40, you still need to take care of yourself. You mustn't wait until when you are 60 before you feel, oh, I can be hypertensive. Anybody can have hypertension at any time. And don't forget that hypertension may also, note that it may also occur in younger people due to certain underlying problems like the kidney problem. If you see a young child of maybe 12 years, 15, 20 with high blood pressure, take that child to the hospital for investigations, because it could be due to underlying problem like kidney disease. So we have to be very careful with high blood pressure, which is the major cause of this stroke. In Nigeria, the prevalence of stroke is 1:14 per 1,000, and a total death of 57,744 published in 2020 by WHO. Every year, more than 7,905,000 people in the United States have stroke, and every 3.5 minutes someone dies. 100,000 people have stroke in the UK each year. Around 32,000 stroke-related deaths in England each year. From this little research, you can see that stroke is a major problem, as it was stated earlier that it is the third leading cause of death. So you have to take care of your blood pressure. If I may ask, when was the last time you check yours? Try. Even if you're not hypertensive, you can be checking your blood pressure, maybe even if it's once a week or twice, or maybe anytime you have headache, you feel stressed, you check. Because sometimes one can have a very high blood pressure without indication. What are the signs and symptoms? Numbness or weakness in the face, arm or legs, especially on one side of the body, confusion, trouble seeing in one or both eyes, depending on the side of brain that is affected, trouble walking, dizziness, loss of balance or coordination, severe headache. All these symptoms you are seeing are related to the part of the brain that is being affected. Later, I will show you a diagram and explain what happens to someone with stroke depending on the part of the brain that the stroke occurred. So what are the risk factors? When we say risk factor, there are those things, they are not the things that causes stroke. They are rather the things that can predispose you to stroke. For instance, high blood pressure, smoking, diabetes, heart diseases, high cholesterol, obesity, family history of stroke. So there is this high tendency that someone that has high blood pressure may have stroke. That is, if the blood pressure is not under control. Then, like smoking, when you smoke, you are taking in so much carbon dioxide into your body. That smoke you are taking in will displace oxygen, causes build-up of a gas that is not beneficial to the brain. You know, the major cause of this thing is poor perfusion to the brain, decreased blood supply, not allowing the brain to have enough or adequate oxygen. So you now smoking, instead of you taking in natural air with oxygen, you now smoke. The bad gas will now take the place of oxygen, leaving your brain with a very little oxygen, so predisposing you to this condition known as stroke. So it is advisable that you stop smoking. Diabetes. Someone can say, oh, how can diabetes cause stroke? When there is build-up of glucose in the system, it can result in stroke, in that obesity is one of the predisposing factor. So build-up of glucose causes tissue damage, which can result in stroke. Heart diseases, which we all know, enlargement of the heart. There are a lot of heart diseases, which I don't want to go into that. High cholesterol. When was the last time you check your cholesterol level? There's what we call lipid profile. Please, if you are up to the age of 40, go and get your lipid profile, and you're supposed to do it every 5 years. Please kindly do that to check if there are 3 major things you will check. High density lipoprotein, which is the good cholesterol. Low density lipoprotein, which is the bad cholesterol. They have ranges. And triglyceride. So when your doctor check, as you collect the result, ask your doctor to explain to you if they are within normal range. If they are not within normal range, if they are high, it means you must have been consuming a lot of fat. So you try and cut down on your fat intake. Obesity, it is very important to work on your weight. Normal body mass index is 18.5 to 25 kg per meter square. So if you know that you are above that, you need to check. How are you going to check your BMI? It is your weight divided by your height times 2. So family history. If you're in your family, maybe your mother or your father or people in your family do have high blood pressure, there is that tendency that you may have. So that is the more reason why you should take good care of yourself by minding what you eat, doing regular exercises, and so on and so forth, or taking your drugs if you are hypertensive. That will help prevent your blood pressure from going very high. Types of stroke. We have two major types of stroke known as the hemorrhagic stroke and the ischemic stroke. The hemorrhagic stroke, when the blood pressure is so high, what it does is that it's going to enlarge a portion of the blood vessel in the brain, which is known as aneurysm. If you can see this is an enlarged blood vessel known as aneurysm. If at this stage the blood pressure is not controlled, what will happen is that this blood vessel is going to rupture. When it ruptures, it leads to what you are seeing here, bleeding. This is bleeding. As long as there's bleeding in this part of the brain, the individual is not going to have adequate oxygen supply, which is perfusion, to this area of the brain. And what will happen? Cells death will occur. And if at this stage too, early intervention is not taken, the patient can die. We also have the second one, which is the ischemic. The ischemic, I told you earlier that there is no bleeding, but just that the decreased blood supply in that area of the brain will just cause brain death, no bleeding. We also have atherosclerosis, which is like a risk factor that causes ischemic stroke. What happens here is that the blood vessels here, there will be accumulation of fat, cholesterol, which I was saying, check your cholesterol. Accumulation of these fats will now decrease blood supply. Like now, if you have that kind of thing here, blood comes from here up to the brain. So if you have atherosclerosis here, it will deprive this area from here up from oxygen. Or if it occurs here, it will deprive the area up here from oxygen. So when stroke occurs in this area now, is due to atherosclerosis. The major type is the first two, but some school of thought add this one as the third type, while other school of thought says atherosclerosis can cause ischemic stroke. So as I said, I will explain in depth when I reach types. So now we are the types of stroke. As I earlier explained, is easy. Ischemic stroke occurs due to blood clots depriving part of the brain of oxygen, or it occurs when there is decreased blood supply to that area and there will be a brain cell death. Then hemorrhagic occurs when there is bleeding. From that name, hemorrhagic, bleeding. There's what we call TIA, transient ischemic attack. Is caused by a temporary lack of blood flow to the brain. That is why you will stay with an elderly patient or maybe elderly person. I know of a colleague that it happened to the father. The father just started sweating. The next thing, he fell. But recovered before they got to the hospital, he recovered. So you see that it's transient, very short. It doesn't really last. The recovery is quickly. if you have an elderly person that experiences that, that person may likely have stroke, and if you don't watch out, it may not live long. So how can you prevent stroke? Controlling risk factors such as high blood pressure, diabetes, smoking, high cholesterol, and physical inactivity is very important. This physical inactivity is every morning you wake up, eat, sleep. Some people have sedentary job. You don't need to sit down all through. From time to time, stand up, move about, give yourself a little break, come back, then exercise. It is recommended to exercise at least 5 times a week, 30 minutes every day. But even if you cannot meet up, maybe due to busy schedule, you can try your best and just make it 2 times, 3 times a week. It is better than not involving yourself in exercise at all. Especially in Africa, I don't think exercise is common. Yes, from what I see, a lot of people don't exercise. Very few knows the importance of exercise. You hear someone say, I don't even have food to eat. You say, I should go and exercise. No, exercise is not for people that have food and eat, or people that doesn't have food. It's not for slim or fat people. It's for everybody. What exercise does is that it invigorates organs in your body. What do I mean by invigorate? Gives life to organs in your body, especially the heart. Like someone that is regular in exercise will have stamina to stroke, yes, to heart attack, than someone that doesn't exercise. Someone that doesn't exercise, your heart is at rest at all time. So if there's any heart attack, you go in for it. But a heart that pumps fast while you are running has stamina. Try and exercise, even if it's a walk. If you have a medical condition that doesn't need much exercise, you can see your doctor for prescription. Like a cardiac patient, there are prescriptions for exercise. That one is another topic. So take care of yourself. Eating healthy diet, reduce your carbohydrate intake, reduce your fat intake, reduce your oil intake, so that you will not build up glucose and cholesterol that may cause stroke. Maintain a healthy weight. As I earlier said, normal body mass index is 18.5 and to 25 kg per meter square. Regular exercise. Drink alcohol in moderation or avoid it altogether. It is advisable to avoid alcohol completely, but trust me, some people will still take it. So even if you have to take it, you have to discipline yourself and stick to the daily recommendation, which is 1 bottle for women a day and 2 or less for men in a day. Taking medications as prescribed by your doctor. For instance, you are an hypertensive patient, you abandon your drugs. What will you experience? A spike in the blood pressure, and when it's very high to an extent that you cannot control, what will happen is either you develop ischemic or hemorrhagic stroke, which some people used to be lucky, they come out, and some die. So it's better you control your blood pressure than to experience stroke. You manage stress. We know that stress is one of the major causes of hypertension. So manage your stress. Rest. Take good care of yourself. Regular monitoring of blood pressure and cholesterol level is also important. Seek prompt medical attention for warning signs of stroke. Talking to your doctor about stroke prevention and your individual risk factor is also of essence. Remember, I said during the function and during the signs and symptoms I earlier mentioned, that the impairment a patient will experience is depending on the part of the brain that is affected. The frontal part of the brain, as you can see here, this pink, this area is the frontal part of the brain responsible for cognitive reasoning. A normal human being that reasons well, think well, has a developed part of the frontal part of the brain, which is what you are seeing here. This is the frontal part. So if blood supply is cut off in this area and the patient has stroke, if this area is affected, what you will see is that patient will not have motor control, there will be no concentration, will not be able to solve problem. That's why you see stroke patient misbehave. It's not their fault. So if you are managing any stroke patient, you need patience and understanding. It is not their fault. They can so misbehave that you'll be wondering what is wrong. Then if it affects this lower part of this frontal area, the patient will tell you, oh nurse, I have lost my smell, I can't smell anymore. Just know that it's because of the stroke. Don't attribute it to COVID-19. That's funny, right? Then you come to this part of the brain known as the parietal. Parietal, here is it. It's mostly the upper side. We have right parietal and left parietal. This is it. The patient will have issue with touch and pressure tests and body awareness. Body awareness in the sense that he may not even know what is going on in him. He may eat food and tell you, oh, I cannot taste food, even when that food is salty. He may not taste. Body pressure, you touch, press, the patient will not feel it. Then if this part of the brain known as the temporal lobe, here is it, temporal lobe is affected, the patient will not hear well. Facial recognition may be affected. Your patient may see you and doesn't recognize you. Just be patient. Know that stroke can cause that. Then if this part of the brain known as the occipital lobe, here's the spelling here, occipital, that's the back of your head, occiput, back of the brain, is responsible for vision. If the patient bleeds into this area or a ischemia occurs in this area, what will happen is that the patient may have vision issue. Then the part of the brain that is responsible for coordination, even balancing, is this part known as the cerebellum. See the spellings here? Cerebellum. The patient will be staggering. So the brain is very important. Why am I taking time to explain this part of the brain and what can happen to you is that so that you know that stroke is dangerous. Yes. So take very good care of yourself. What are the complications? From what I've finished explaining, the part of the brain affected will result in what you are seeing: communication, physical disability, cognitive problem. As I earlier said, the front side, if it's affected, it will cause this cognitive problem. Emotional and psychological effects such as depression, anxiety, mood swing, swallowing difficulty, pain or discomfort, blood clots, pneumonia. Pneumonia occurs when a patient has stroke, will be on bed for a long time. So pneumonia will now occur since that the patient is on bed, no movement, no activity. So that risk for pneumonia is there. And being that they may have swallowing difficulty too, they may aspirate food. So you have to be careful. A patient that has swallow difficulty, you will not be feeding that patient. That patient should be on a nasogastric tube. They put tube and feed. So I advise that most cases of stroke, take to the hospital. Let the doctor diagnose the stroke, treat. If the patient needs home care, much later during discharge, the relative will be held educated on how to care for the patient at home. Please, I see it a lot I see it a lot here that people will keep stroke patient at home and nurse maybe due to lack of funds, but it's not advisable because you may end up losing them. So if the patient cannot swallow, you keep feeding that patient. What that patient will have is what we call aspiration pneumonitis. He cannot swallow food. The food will now enter the trachea and goes to the lung, inflame the lung, and cause aspiration pneumonitis. So patient can also develop bed sore due to immobility. Thank you so much for your understanding. Please drop all your questions in the comment section. Don't forget to like and subscribe to support me. Thank you.